For Budget Ghana, it's a pleasure to be here to speak about what we've done so far on the CTAP project. As you mentioned, COVID really had a great impact on all of us. And now we are still feeling it. I think there are a number of countries, including Ghana, who are going through very deep recessions, not just because of COVID, but because of the war in Ukraine and all that. We are really going through quite a hard time here, and that's increasing people's appetite for accountability. It's making more people ask more questions about, okay, so what have we done? How well have we managed the crisis compared to other countries? And the answer really isn't that great. People are upset. People want to know more. So the gains that we made in CTAP phase 1 are now being actualized or pushed further in CTAP phase 2. As you mentioned, we had a program today with the Local Accountability Network in Kumasi, which is the second capital city of Accra, the second biggest city in Accra. And this is to host 60 to 70 of the Local Accountability Network members and to teach them fact checking. I think the program is just about ending now. So it's great that we are having this almost simultaneously. But as I mentioned, there's really an appetite for more information, and social media was the key technology that was quite influential in this process. I think we had at some point a campaign with the hashtag Fix the Country, and in a single day there were about 400,000 posts on Twitter with people posting all manner of information and content, basically showing their displeasure with the government and the management of the economy, mostly as a result of COVID. So within this, you could also see some of the content and the dissatisfaction people had with healthcare services. And that is quite telling that it came out in such a big way. So if anyone is able to go on Twitter, you can type in Fix the Country. You'll see just a whole bunch of content between now and as far back as last year, when people were really voicing out their discontent with the government. And then within these, you would even be able to see some of the hospitals that were posted, some of the healthcare facilities that people were dissatisfied with. So as you're saying, there's a very big conversation happening around that. Last year as well, we were also pushing with other CSOs, working with local government officials, speaking with healthcare professionals about their insider information that they have. This year, we also worked with the regional health accountant for the Ministry of Health, which is important because that's where all the funds are flowing through, and that's where they are really implementing other projects. And again, the verdict wasn't good. We had him at our first coalition meeting, basically to give a presentation to the other CSOs for areas that they should look out for when you are trying to keep stakeholders involved. But one area we identified as a gap was with the traditional leaders, which we are trying to bridge this year by involving them. These are very powerful people at the local level, at the grassroots level that you cannot necessarily penetrate without. And that's where we ignored last year that we are trying to improve upon. So CETA phase 1 was really about going wide, expanding people's awareness, trying to leverage social media, use hashtags like Fix the Country to get people to be aware and raise their level of consciousness about the need for accountability. This year, CETA phase 2 is allowing us to deepen those connections and to have more capacity building for various stakeholders that we identified are in need of it, such as the Local Accountability Network. So yes, we have also realized that with social media, there's quite a bit of information on there. It's the greatest strength for social media, while also being its greatest weakness. Is that people can post anything, and you're able to get a very decentralized portal of consciousness and people posting stuff that's quite relevant to know. But then you also get a lot of people posting information that is from a different country, or sometimes from a healthcare facility that used to be in poor shape but now has been renovated. So it's a very delicate balance that we have to strike in using social media. And that's an important lesson for other countries who would seek to use social media to basically augment their message. So given that, we decided that fact checking would be extremely important for the local accountability network, because we needed to let them know that yes, social media is a great tool. It will supply you with a lot of information and it will really help you to elevate your message. But there's a key aspect of this, which is fact checking, that you need to be very careful about. You need to know how to get information from social media and then verify the information using various tools. And then also share the information in the right way using the hashtags. Perhaps if you have to tag accounts, because sometimes you can post something, if you don't use the right means, it just adds to the noise and just goes unnoticed. So this was an essential training that we felt we needed to deliver to the local accountability network. And we are very glad to have had the Open Governance Partnership as a part of that program. Unlike Nigeria, where we have the National Action Plan ending this year, ours actually started last year and will finish in 2023. So we are in the middle of an action plan implementation. But that's even advantageous for us, because then we get to move with them and learn more about how mainstreaming of health in the action plan would look like. What are the implementing agencies? Can we include traditional leaders? Can we include various stakeholders that in previous action plans haven't been involved in the process? Because that's really the point of OGP, right? Is to have all the various stakeholders involved. So those are key lessons for us that we are carrying forward into this year. I'll stop my remarks here. If there are further questions, I'm sure we can address them in the Q&A sessions. Thank you so much.